It's not easy to see a child suffering, but in strife-torn Afghanistan, it's a reality. This is 9-year-old Ahmadullah. He was shot through the head in the volatile province of Ghazni. Doctors aren't sure he's going to make it.
Unfortunately, Ahmadullah admitted 1 day ago during the night. It was bullet injury into the head, very, very bad injury. I mean, bullet through the brain directly.
He arrived severely disabled and was immediately rushed to the operating table.
What's the worst case scenario if he makes it through? Will he have brain damage?
For sure. For sure, brain damage. He cannot be completely fine as he was. We are fighting to survive with a deficit for sure. But how much deficit, you never can know. The quality of life and the way of life will be the different and the change.
The need for dedicated trauma care has never been so critical as healthcare joins the long list of casualties in conflict-ridden Afghanistan. State-run facilities struggle to supply even basic medical attention as insecurity and limited resources challenge the system. Private clinics are now being closed down for providing substandard care, and hospitals run by NGOs have also been targeted in the ongoing violence. Yet emergency hospitals, run by an Italian NGO, have managed to beat the odds. Their Kabul hospital has never been busier. Every day, patients arrive from everywhere.
From Ghazni, from Tagab, from all the place around Kabul.
With every kind of war injury.
Injured due to bullet, due to shrapnel after explosion, due to direct impact with the mine, landmines or direct explosion. And we include also the stab injury, because one is a violence act that could be connected with the instability of the situation around.
Local Afghan surgeon Mir Abdulazim has been working here since 2003, but he's been coming here for much longer.
When I came to start working as a nurse, the international nurse he came and he wanted to show me the rooms, the wards, this part. I told him I'm used in this hospital. He told, you have been working here? No, I told him when I was a child, this place was kindergarten for the children, and I was here.
After a rocket killed 5 of his classmates, the ground sat empty for many years, until the Taliban occupied Kabul in 2001. Emergency entered Afghanistan in 1999 during the country's destructive civil war and established their first hospital in the northeastern province of Panjshir, which at the time was controlled by the Northern Alliance, a military front that fought the Taliban.
We immediately realized that if you want to be neutral, you need to offer the same service to all the actors involved in the conflict. After the establishment of the first hospital, we crossed the front line and we came here during the Taliban regime, and we proposed the same offer we did to the North Alliance.
The Taliban agreed and donated the land to them. Since then, they have never interrupted Emergency's work.
Emergency is a vital lifeline to the Afghan people and their communities. The majority of NGOs who work in this country must do so with substantial security. Yet here, they rely on the good work they do to protect them from becoming patients themselves.
Emergency prides itself on being completely neutral, only asking patients questions related to their injury. They offer a high level of care at absolutely no cost.
If is my brother, if my family, or if these people are Taliban or soldiers, for us, all of them the same. We are going to deal with all of them at the same levels.
To be admitted, a patient has to be a victim of Afghanistan's unrelenting war. When fighting worsened in the south, Emergency opened their third hospital in Helmand province. Emergency also runs dozens of smaller first aid posts in some of the most remote and dangerous pockets of the country. These centers offer basic primary health care and timely attention to trauma victims.
The idea is to offer a prompt and proper assessment for traumatized patients and transfer the people from the clinic to the hospital with ambulance and nurse on board.
With more than a dozen trauma patients on average admitted daily, the hospital has a remarkable survival rate. Emergency is able to save roughly 9 out of 10 of those admitted to the hospital, on par if not above the average of standard general hospitals. Italian nurse Giorgia Novello believes genes play a big role.
They have much better immune system developed than European people, that's for sure.
Why do you think that is? Is that because they've sort of lived a hard life generation after generation?
Probably. That genetics makes you stronger, to be stronger.
Experience of the staff could also have a lot to do with it.
These doctors are doing an average of 60 operations weekly each. These people are able to treat a traumatized patient injured from the head to the toe. In Italy, you need a team of different specialists, for example, sharing the responsibility of what they do. They just work continuously.
It's big.
Emergency saw a 30% increase in patients and operations in the first quarter of 2016 from the same period in 2015. 4 surgeons and 5 nurses care for over 120 beds. For the Afghan staff, watching their country deteriorate and their children die is proving an even greater challenge.
It's very disastrous. When we are going to see these kind of patients, it's not one day, it's not 2 days, it's not 1 week, it's not 1 month. Since 2008, I became a surgeon. Since 2003, I was starting work in this hospital, and I have seen this kind of patients are coming and going, coming and going.
It's family day. Some patients are wheeled outside to enjoy the sun with visiting family and friends. But 9-year-old Ahmadullah spends the day inside, alone. His family hasn't yet been able to make the 3-hour journey from Ghazni to Kabul. Afghanistan's poor infrastructure makes it difficult for relatives to be by their loved one's bedside.
How crucial is time to an injury?
A lot. It's called golden hour in the trauma. Here it's called a golden day because sometimes they're coming after 2 days, 20 hours, 15 hours. So you lose a lot.
Ahmadullah arrived 7 hours after his injury, increasing his odds of survival. The team at emergency covered the hole in his skull with a skin graft from his thigh.
So we have a good results. So that means our team, our surgical team in emergency, they did a really good job, and they saved his life of this child.
Doctors expect him to make a full recovery. The Afghan Public Health Ministry estimates that there are now over 2,000 health facilities across the country, compared with about 500 in 2002, but their quality is in question.
Afghanistan really needs this kind of hospital, several hospitals. Unfortunately, the situations of other governmental hospitals day by day becoming down. It's a disaster. It's disaster.
Emergency is also helping train a new generation of healthcare specialists from all over Afghanistan, but because of worsening insecurity in the country, many are taking this knowledge abroad.
The last 5 years of our experience here are the worst that we ever had in Afghanistan in terms of a mission. We are talking about a period that should be the end of the war, and I feel very sad and sorry.
Yet some are staying, hopeful that they can make a difference in the future of their country, regardless of the odds stacked against them.
So I don't know, that God put me here from the beginning, and I don't know when it's going to be remove me from this part. Actually.
For Simon Asia, I'm Natalie Carney in Kabul, Afghanistan.